Good afternoon, everyone. My name is Ifeanyi Sulfur. I work with Nigeria Health Watch, and I'll be moderating this event today. Greetings from Abuja, Nigeria's federal capital city. This is the second in the series of our hashtag Prevent Epidemics Nigeria webinars. And for this particular hackathon, for this particular webinar, we're going to focus on look at funding streams for COVID-19 in particular, and generally funding for epidemic preparedness in Nigeria. So our hashtag Prevent Epidemics Nigeria project has been running for the past 17 to 18 months. And for the project, we have two major objectives. The first one is to increase funding for epidemic preparedness at the federal level as well as state and local councils. And the second objective of the Prevent Epidemics Nigeria project is for us to increase awareness as far as infectious diseases and epidemics are concerned, because for us at Nigeria Health Watch, we believe that there's so much that CSOs can do if we don't have an active citizenship for health. So those are the two major objectives, and we're happy that for this particular webinar, we have two distinguished speakers. Her Excellency Dr. Zainab Shinkafi Bagudu, who is the First Lady, the wife of the Governor of Kebbi State, but also who is a doctor, a pediatrician, a cancer advocate, and an overall important person within the health sector. Dr. Zainab, you're welcome.
Good morning, Dr. Ifeanyi. How are you? Good morning, Zoira. How are you?
Hello, Dr. Zainab. How are you doing? Good to see you.
Okay, thank you so much, Dr. Zainab. And our second speaker is Zoira Yusufu, who is the Managing Director and Chief Executive Officer of the Aliko Dangote Foundation. And prior to that, she also worked with the World Bank. She worked with the European Union, as well as did some management consulting with Deloitte in Ghana. Thank you so much, Zoira, for making our time to join the meeting today.
Thank you. Thank you very much.
Okay, thank you so much, Zoira. And we're also happy that this webinar is a total 1L. We have two female speakers. For us at Nigeria Health, well, that is something we're really excited about once to have women be on panels. So having two women, very distinguished women as speakers at this event is a great one for us. I want to thank everyone who has joined. I've thanked the speakers. I want to thank every other participant that has joined from different parts of the world. And I know that as we progress, the number of participants will also increase. So what we want to do first is just to do a very short poll, just two questions. My colleague Ugonna is going to project the poll. So please just participate in the poll, because it's going to help us understand, people's perceptions about epidemic preparedness as well as funding for it. So the first question, I'm sure everyone can see the poll. So the speakers will not be able to take the poll, just the other participants.
Yeah, I see, because I was trying to click.
Yeah, sorry about that. Yeah, so the first question is, who should fund epidemic preparedness in Nigeria? First option is federal government, second, state government, local government, private sector, then all of the above. Then the second question is, you should do the following to prevent community transmission of COVID-19. Ugonna, if you could scroll down, the first option is wear a face mask in public, wash hands frequently with soap and water, practice social distancing, all of the above. Then the last option is boil and drink ginger and garlic. So let me just give a minute for everybody to participate in that, so that we can look at the result and at least use that as to segue into our discussions today. Okay, thank you so much, Ugonna. Okay, so interesting. The first question, who should fund epidemic preparedness in Nigeria? 11%, said the federal government. Nobody chose the state government specifically. None chose the local government specifically. 1%, the private sector. But 87%, chose all of the above, which is quite significant. The second question, you should do the following to prevent community transmission of COVID-19. First one, wear a face mask in public, 2%, wash hands frequently with soap and water, 4%, practice social distancing, 7%, and again, 87%, all of the above. And to be honest, I'm very happy that nobody chose boil and drink ginger and garlic because that obviously has not helped anybody. So both questions are tied. The answers are tied. It's 7% for each chose all of the above, which is really, really statistically significant as far as these questions are concerned. So thank you all for participating in this poll. So I'll just go right into the question, and I'll start with Her Excellency Dr. Zainab. So if you look at epidemic preparedness for COVID-19 is concerned, how prepared do you think Nigeria was in terms of funding for preparing for COVID-19? And I appreciate the fact that you wear several hats. You're a doctor, a pediatrician, you're a first lady, you're a cancer advocate at the national and international level. So when you consider all this, how prepared do you think Nigeria was for funding COVID-19? Dr. Zainab.
I think we're all very unanimous about one thing. The COVID-19 pandemic hits the entire world kind of unawares, not just Nigeria, but indeed the whole that it reacted, where there's still a lot of argument about the reaction of the main body that is responsible for declaring an emergency. So as a country, the novel outbreak was quite surprising. That's much we're clear about. Generally, we tend to have ill-prepared budgets. The approved budget from the Ministry of Health for 2020 that was set aside were under epidemiology, for preparedness and responsiveness to epidemics nationally. And this includes the recurring Lassa fever without even considering anything that is coming up such as this. So this amount is grossly inadequate. We're not even coming to the state level or the primary healthcare level that ultimately required things like PPEs and testing that this pandemic brought about. So the funding definitely was inadequate, and so we were not so prepared. Having said that, and obviously there was no allocation at all. Having said that, there were some units that had EOCs, that is the emergency centers set up, like ours in Kebbi. We enjoy a reasonably good relationship with the NCDC, which is not unique. There are some states that have had this kind of preparation ongoing. There are engagements with preparedness with organizations that are interested and have been doing a lot of work in this kind of preparedness, such as yours. I said to you the other day, like a joke, is it that you had some form of witchcraft that, you've been going on about this and doing this emergency preparedness for some time and having the talks and the seminars around this issue. And Kebbi State is one of the lucky states that has been engaging with your organization, EPI-Afrique, Nigerian Health Watch, as well as the NCDC. There has been some form of connection to get the EOCs ready. We had an EOC, not much was heard about Kebbi in terms of the COVID-19. Maybe you didn't see us in the news displaying a lot of flash equipment or tents. They didn't come and build a tent. I don't think they did, because we had a reasonably well-equipped hospital that was very easy to convert. We had an EOC center that was set up already, and it was there, and we had good personnel, some of whom were actually poached into the national response team because they were already so well prepared and they were trained by the NCDC. So these are little things that in our own way we were ready and we were able to pull those kind of responses that people didn't really appreciate, and it didn't cost a lot to do. But that notwithstanding, there was still a lot that needed to be done. We didn't need to buy ventilators, not that we didn't need them, or we had a lot. There was a map that came up and we have just one planners, like getting to the grassroots to talk to the people, and the other PPEs that we needed to get ready in the general hospital. So I think on a scale of, if I were to put it on a scale of 1 to 10, Nigeria, I'd say give it a score of about 5. The health system is weak, there's no doubt about it. It's not all good, but it's not all bad. On balance, it hits the worst and the best possible of places. If there's anywhere that could have been, you know, as ready in terms of funding, in terms of availability, I'd have picked Lagos. Most funds and availability and ability,
Okay. All right, thank you so much, Dr. Zainab. And no doubt about that, we also feel that Kebbi State had invested in epidemic preparedness because one of the workshops that we did under this project, the speaker was your then state epidemiologist, Dr. Assad, who did a very good job of speaking to the audience about KB's preparedness for epidemic, but in particular how you responded to a Lassa fever outbreak. So thank you so much for giving us that context from Kebbi. So Dr. Bagudu, so the second question for you, so if you look at, I appreciate what you said initially about our level of preparedness as far as funding epidemics and COVID-19 is concerned before it happened. So if you look at the different funding stream for COVID-19 in Nigeria currently, how would you assess it? The different funds available for COVID-19. What's your own perspective?
It's not adequate, definitely. If you look at the federal allocation, if you look at the state budgets, and if you look at the fact that it can be better, it can always be better. As health advocates, we tend not to talk to these things. We tend not to really push for where it should come from. For instance, I was just musing the other day with my husband. We have a national emergency body. It's called NEMA. They have branches in the states called the SEMA. But we never advocate for funding from NEMA for health emergency. Why? You never hear about NEMA working with the NCDC. Correct me if I'm wrong, but I have never heard about it. We hear about NCDC soliciting for funding from the House. They look for their own budget lines of late, yes. And then I am sure that
hello, please, if you're not speaking, can you mute your mic, please, if you're not speaking? Thank you.
When we have floods,
sorry, go ahead.
When we have floods, they rise to the task, they take food to the affected communities. But why can't there be a health line for epidemics set aside for emergencies? Because that word is in their title, is national emergency, so why can't it be there? Why can't we have for epidemics? And epidemics is a national emergency. So, but we don't talk about it. It's not there. And the interregional cooperation that is required for the we can imagine we have that kind of interbody cooperation. Funding streams, they have to come because the internal streams are just not adequate. We have to have the international donors, we have to have the partners and the private bodies. And I'm glad to say that this time everybody jumped up and came together. But it shouldn't be so system whereby it happens all the time and it's already there and we have a COVID. I hope that when this goes away, if it goes away, I think that this is an epidemic or a way of life that is here to stay with all of us, that they will leave that structure in place whereby we have private sector funding and they are the ones deciding how they're spending the funds, how they're distributing it to the states, and what they're distributing to the states. Yes, they take input from each state or from the bodies or the relevant bodies in charge of managing the epidemics, the task force or whatever they're called in the states. But they decide what they spend their funds on, and they take the relevant people. So I hope that they will keep that kind of structure in place for doing their CSR to the health funding. I've said it a million times and I'll say it again now. The COVID-19 pandemic is not such a health thing. I commiserate with the lives that have been lost, but the biggest message or the biggest lesson out of it is that it is an immediate wake-up call. It has been an immediate wake-up call to everybody to get up and do something about our healthcare system.
Okay. Okay, we seem to be having some interference. I'm not sure where it's coming from.
And beyond that, this is a wake-up call that has had an immediate and synchronized response. So the result, of course, is that our health system has received the kind of funding that it has not received ever, be it from the private sector, international donor agencies, government everywhere. Okay. 10 billion that went to lay, 5 billion to Kano. One or the other, it has affected me in Kebbi. And it's the current funding streams that came in for the COVID-19 response. It's been awesome. I think Zuwaira is back.
Yeah. Thank you so much, Your Excellency, for that. Zuwaira, welcome back. We lost you for a while there. Okay, so my first question to you is, the Aliko Dangote Foundation is the largest grant-making foundation in Africa. And to me personally, as someone who has worked with another grant-making foundation, indigenous one, Tiwa Danjuma Foundation, I think it's something something to be proud of, that Africans are setting up structured grant-making foundations. So from the work that you do at the Aliko Dangote Foundation, what kind of activities did you guys engage in, to prevent epidemics before COVID-19?
So specifically the foundation by ourselves, I would say outside of the work that we've been doing with COVID, we've been doing a lot of the continuation of the work that we did during the Ebola crisis. So for instance, immediately the first case was identified on February 27th. The very next day, the Nigerian CDC sent out an incident action plan in which they were asking for support from their regular donors, which include, us, the Gates Foundation, WHO, USAID, etc. And that incident action plan at the time had costed the intervention at 1.6 billion naira. That's what NCDC thought they needed to manage the COVID-19 crisis at the time. So we immediately pledged 200 million naira, which we have redeemed. We thought we could do the work related to port of entry, which is really around how do we make sure that, people coming in are okay, that we have proper screening, that we have, people there who can manage our people entering from the airports in particular. And that was, a logical next step for us because, like I said, during the Ebola crisis, we set up all the thermal cameras in all of our international airports here in Nigeria, and we've been maintaining them, and they've been there since. But a little while after that, we also had, the crisis kept growing. And so Alhaji Aliko and Herbert Wigwe were talking and said, look, we need to do something that's bigger, that brings the entire private sector together, not just, because everybody doing it on their own will just be small pieces of the pie. Let's just put our forces together and see what we can do. So that's how COVID was born. Now, in addition to my regular job as heading the Aliko Dangote Foundation, I then was also made responsible for managing the COVID Secretariat. So COVID is the coalition of private sector to fight COVID-19. And within this coalition, we're doing three things. So that's why I wanted to separate what we're doing as ourselves and what we're doing in the group. So as ourselves, as just Aliko Dangote Foundation, we bought ambulances, we've supported SORMAS, which is the surveillance system. This is what we did as a redeeming the initial pledge of 200 million naira. In addition to that, we've contributed 2 billion naira to COVID. And with this 2 billion naira, a lot of what we've been doing as the organization, that's gone into that. We've raised about 30 billion naira so far, and we're focusing on 3 things. One is increasing testing. Testing was very low in the beginning of the crisis. It's still not where it should be, but it was really low. 2, making sure that we have isolation centers across the country so that if people are sick, when they're identified, when they're tested positive, that we know what to do. And the 3rd thing is making sure that we have palliatives around the country, targeting 10 million people. So that's specifically what COVID is doing. Now, in addition to that, in addition to our contribution to the COVID, we also did extra interventions in Kano, for instance. Kano, as some of you might know, Alhaji Aliko is from Kano, and Kano was having a particular challenge specifically around testing. So we mobilized and we bought and brought a lab in Kano that can do up to 1,000 tests a day. So that lab is there, it's working. They're getting samples from the state on a regular basis to test in Kano. So that's something that we did while we were in COVID, but that was not a COVID project. That was an ADF project, because imagine if everybody had to say, well, in my state, we have to do extra. It would be a challenge. So we've done the lab, and we're able to contribute to reducing the testing challenges in Kano. There's a lot more that we need to do. We've been doing training of health workers. We're thinking of a plan to get some health workers across the country who are, it turns out we have unemployed or underutilized health workers. For instance, people who work in private clinics that were closed down or that reduced their activity during the crisis. Those people are needed in other parts of the country where they don't have enough. So we're working with the Nigerian Governors Forum to see how we could implement something like that quickly, get people trained and move them from different states. We would support then their extra pay, their transportation there. The state would be in charge of their accommodation, et cetera, so that we could have, a more even spread of our health workers in the country. So it's been a lot. I know that the next piece of things that we're thinking of is, how do we prevent these epidemics? I mean, we had a very interesting conversation with Dr. Chikwe, who was always talking to me about, look, where we need support to manage these different crises. We had Lassa fever, we have these epidemics keep coming, we need more surveillance, I think now that message is clear, because even those who weren't as convinced of the importance of having a proper surveillance system and also having a healthcare system that can deal with these issues, I think the reality now is, see, we're all here. There's no more medical evacuations happening. Nobody's able to just fly off to Dubai or to the US to get treated. We're here. And if we don't fix our own health system, this is it. This is our opportunity to really make a difference. And I think the energy from the various governors, from the private sector around, look, we really need to do something specific to make sure that our health system works in Nigeria. I don't think we've had a better time than this horrible crisis to put us in front of what will happen if we don't have the system in place, which we completely have the capacity of doing. I mean, Dr. Zainab is proof. We have people like her who know what to do. We have enough doctors and nurses and health practitioners. We have enough money in Nigeria to have a proper health system. There's no reason why we don't, right? There's no real reason. There's no structural reason why we can't have a proper healthcare system. It's just not true. We just haven't focused on it specifically. But I think that this crisis is an opportunity for us to really focus on those things.
Okay, thank you so much, Zuhaira. And we're really grateful to Aliko Dangote Foundation for all you've done and all you're doing. And in particular in Kano, for me, I grew up in Kano, so Kano really occupies a very special place in my heart. So thank you for what you're doing in that state. And I think that COVID is definitely a game changer in the way that not just epidemics, but health in general, should be funded going forward. So from that experience, managing COVID and obviously engaging with other private sector actors, as well as government actors like Dr. Hekwazo, what do you think? Can you share with us two ways we can, learnings from that can help us sustain epidemic preparedness for the future? Because definitely more epidemics will happen. It's not a question of whether it's our portion or not. They would happen. So how do we sustain funding for epidemic preparedness?
So what I know is that working with these private sector leaders, because within COVID we have a supervisory committee, funding committee, technical, we have different committees, and just working across the committees, the absolute commitment to making things better is clear. So the lesson is, it turns out that when we have to, we really know how to collaborate, and we know how to partner, and we know how to get it done. So it's a fact now, the same way that it's a fact that we can have these meetings on Zoom and we don't have to fly around to meet in one room. Okay, now the proof is we can really have these calls on Zoom. The proof is when we need to, we know how to come together and get things done. And I think it's really a very important lesson for everybody. Everybody feels the same stress about the economy, the economic slowdown. Everybody feels the same stress about, elderly relatives and what could happen to them if, God forbid, they catch the disease. Everybody feels the same stress about, we live with people in community, and what happens to us if we catch the disease, if we don't have a strong mechanism to sort it all out. So I think that the difficulty is before we didn't have as much of an incentive. I think this is like a eye opener that, look, we have to do it, and when we have to do it, people know how to come together and get it done. And two, when we have the same incentives and the same reason to do things, we really know how to come together and get it done. I mean, they're pretty basic lessons, but I think they're very important in just clarifying what it is that we need, that we can actually do together and then also, I think that the important point of the collaboration between the private sector and the public sector. I mean, we work very closely with NCDC, very closely with the PTF, the Presidential Task Force on COVID, working very closely right now with the Port Health to make sure that, how do we make sure that returnees coming back are tested and properly processed, et cetera. So these joint public-private partnerships they work, and we're in the middle of the proof that these things actually work.
Okay. All right, thank you so much, Zuwaira. Okay, we'll just start taking some of the questions that are coming up from the participants. So Zuwaira, you may want to answer this. Okay, so what advice will you give to government to use these extra budgetary funds like COVID, for example, to use that in strengthening our health system going forward?
Okay, so COVID isn't extra budgetary funds. Like we're not writing a check to government. So it's not extra budgetary funds for the government. The way the funds work is that we buy what is needed and then we give it to the government. With testing, we've ordered 250,000 Roche cartridges, for instance. So when they come in, or as they come in, we give them to NCDC to now be managing and dispatching to the different labs. We've ordered the Cepheid cartridges, which are the ones that go in those machines, the gene expert machines we have like 300 or 400 of them across the country. When those tests come in, then they get distributed across the country. So we're not giving the money, we're not writing a check to government. Okay. The isolation centers, we're building them ourselves, we're buying the equipment and donating to the various states. For the palliatives, we're buying them, sending them to the states and making sure they get distributed to the needy people. So just to clarify that we're not like extra budgetary support to government. I think that's an important thing to clarify. But what do I think they should do? with the extra money that comes in, if they get extra money, I really think that the key is to be able to test people, manage people who are positive, reduce the panic in the system, and reopen the economy. Because no matter what happens, COVID is just one more thing that is happening to us, right? Like we live here in Nigeria, and for instance, malaria kills over 300,000 people in Nigeria every year. So far, as far as we know, we have how many people have died of COVID in Nigeria? I mean, the number, every death is a death. It is horrible. But I'm just saying, if we had to just look at the number of lives that we're losing to COVID-19 right now, it doesn't match up to how many women die in childbirth. It doesn't match up to how many people we've even lost with Lassa fever and with things like malaria. So COVID is here to stay. So what we need to have is a plan for how to deal with it and how we're going to go back to work and go back to our lives and travel and go to work and have the factories running and the banks running and people going to work and to worship, etc., while not exposing ourselves to, you know, one more problem that would cause issues to us. So I would say anything that goes towards reopening the economy in a safe way is how the funds should be used. It's not that we need more isolation centers, for instance. Why? Because when we look at how isolation centers are used in other countries, people only go to the isolation center when they're sick, not because they tested positive. I know many people personally who have either tested positive for COVID and who have it. Yeah, so I really think that it should be about how do we safely reopen the economy, because people have to get back to work. And we have to get back to life.
Okay, thank you so much. Yeah, thank you so much, Zuwaira. So Dr. Zainab, do you want to summarize your thoughts from the last question before we ask the next question?
Yes, I think I was talking about our cancer patients and how we supported them. That went quite well. We had the right support. We gave them the right support, both online and offline. And we were also to organize not just some areas of Zamfara State. I'm also associated with a foundation set up in my late father's memory. So we approached some corporate organizations and we were able to get support from them. And we distributed those palliatives the usual way that it's done. And that was quite successful as well. There was a lot of palliatives going on. Some of the organizations, they didn't even want you to write them. They would just say, as long as you're going to distribute these things, they would just send the palliatives and we would do them in different forms. You know, so many efforts were made all over the country, and we're very grateful for that. We did some under the auspices of the Nigerian Governors' Wives, Northern Governors' Wives Forum. We put some of our money together, and then the forum donated some. I think we did 200 per state, and we were able to go to different places and impact upon the lives of women and youth in particular. We were also able to do some training with some of this funding that we had, training women, local women in mask production, the fabric masks that, yes, they're not ideal, but at least we're able to give the rural people something to use and leave the surgical masks for the healthcare workers. I found that in the rural areas, there was little or no awareness on usage of masks. So at least if they have this tapunkumi, as we call them, they're able to have something to use. We organized some classes for the younger ones. When I say young ones, I mean like 15 to 16-year-olds, and to educate them about COVID much earlier on. And, you know, there was a lot of activity, of course, observing the social distancing, awareness in all the 4 emirates of the state. And these are all the things that the organizations and myself, my office, and the different caps that I wear has been able to do. And like Zuwaira said, it's been actually very busy. The Zoom meetings has engaged us a lot, nationally, internationally. I've been in learning classes, educating myself about the pandemic, about the virus, the science of it, the vaccine processes going on. Daily, there's something to learn, and you can only be, lazy or bored if you want to be.
Yeah.
So,
Okay, thank you so much, Dr. Zainab. And I think that what you've done through, Medicaid Foundation and the foundation set up in your father's memory, they are really very important, because I think what COVID-19 has taught us is that funding for epidemic preparedness must include palliatives, because when the economy is shut down, business is shut down, people need to still live. So I think going forward, this is, planning for how to provide social support to communities, something that we should factor in funding for epidemic preparedness. Dr. Zainab, I also want you to take this particular question. We have just about 10 minutes left to the end of this meeting. So I think if we can take like a minute to answer every question, we can accommodate as many as possible. But the first question here is that this person asked and said, I believe that primary healthcare is the bedrock of epidemic preparedness. What are we doing, we now, Nigeria as a country, to advocate that our health system should focus on strengthening our PHC so that we can be better prepared for the next epidemic or pandemic? What are your thoughts?
Well, I'd say we need to build human capacity at the primary health care. Training. We cannot overemphasize the importance of training, bringing everybody together and responding as a group. Disease surveillance cannot be done in isolation, as we have seen. There is no point if one state responds without the cooperation of the other states. Some states tried it, and until they sat down and became humble and did it together with their neighboring states, or even the ones that are far away, then we had good and better responses. So if we train the primary healthcare workers as a whole and a continuatum, and we keep it up, not just at the end of it, like we tend to do with these things, forget about it and it goes away, and that's it, our response is less, then we're not going to get good results. So training, disease surveillance as a continuatum, continuing the funding mechanisms that have been set up now, the private sector funding that is coming in, the government dedicating more funding to the epidemics at all levels, health advocates talking to the problem, and ensuring that when there is funding going into emergencies, we talk about the health sector and ensure that there is funding made available for it. There's absolutely nothing to be shy about it. We demand for funds for buying our medication, so we can ask for funding for epidemics as well, because at the end of the day, that is what we're going to use it for. And there is nothing wrong if, as a health personnel, I ask for money to fund my systems. But we tend not to do it because for some reason, we're doctors can't even ask to be paid. And I don't know why. It's just a part of our training. But even if we can't, then we can employ the business people to do it for us. And Zuhaira, I'm sure, will help us to.
Okay, I hear you, Dr. Zainab. But remember, I'm part of your constituency, so we're going to ask Zuhaira to support the work that the doctors do. So Zuhaira, this question is for you. The person is asking that, so from the funding of Aliko Dangote Foundation, some of them go to palliatives. How do you ensure equity in distribution? How do we ensure it gets to people who actually need these palliatives and not to people who don't?
Yeah, so that is the biggest question that we've received when it comes to palliatives. I mean, the truth is, the only way to make sure that food gets to where it's supposed to is when we do a distribution together with the state. I know that there's a lot of, I'm not going to call it unease, maybe, people thinking that we're just going to, give, dump the food at the feet of government and then tell them to work out how it's done. But the plan that we're putting together includes using NGOs, local NGOs, and the state and us, COVID members, to do the distribution. We're used to doing these distributions as Aliko Dangote Foundation. We've been doing them. I've been here for 5 years, and every year we've done massive food distribution. We've never done it to this scale though, because 10 million people, like 1.7 million households at the same time in Nigeria, is an unimaginable logistics challenge, right? Even just getting the food to the states has been difficult, because imagine we're trying to do this gigantic ordering at the exact same time as the factories are reducing their output, as they have to put in place COVID containment measures inside the factories, as the borders between states are closed, and so movement of traffic is impeded. So it's really been a challenging process, but the distribution is going to happen together with COVID, with the state, and with local NGOs who are used to doing this. And our goal is to really get it to the people who need it. And we've done it before, so I don't know why we shouldn't be able to be successful this time also. And it makes me sad a little bit sometimes, like the suspicion around, well, if you give it to, government, they're not going to do it. I mean, there's always this sense or this suspicion that government isn't as invested in the welfare of people. And I think that's a difficult, really, I'm not a politician, so this is not like my thing to fix, but I think it makes me sad that this mistrust is still there, especially when it comes to supporting the poorest people. Remember, these 10 million people that I'm talking about, the 1.7 million households that we're targeting, that's the 5% bottom of the pyramid of Nigeria. So who is it who wouldn't want them to get rice and gari and, 5 kilos of sugar? Like, we're not talking about, something, we're not giving them cars, we're not giving something gigantic. It's food for people to eat because they're hungry. And I do think that we're going to be successful with this distribution because everybody recognizes that we need to do something for the poorest amongst us, the ones who are suffering the most. We have to make sure that they get this food. And I think everybody agrees, from the governors all the way to the local, government chair people.
Okay. Okay, thank you so much. Dr. Zainab, this question is for you. And I think this will be the last question because we just have 5 minutes to go. Dr. Zainab, the person is asking, sustainable funding for healthcare delivery as well as epidemic preparedness going forward can be achieved through a functional health insurance system. How do you think we can make that work in Nigeria? Bearing in mind that I think close to about 31 states in Nigeria have signed health insurance laws. How can we have a sustainable funding model through health insurance across the country? If you can do that just in about 2 minutes. Okay, your mic is still on mute.
I hoped you would ask that question, but before I move on, I just want to say that this palliative thing is really boring, so where I don't feel bad about it. It's really something that we should all think of. There's so many questions on there about palliatives, but we'll just have to keep on doing what we're doing and keep doing it to the best of your ability. And you're not accountable to anyone but to God. And just keep doing it. You're doing a fantastic job, and we'll all just keep doing it. And that's it. Health insurance is the only way forward.
Thank you for saying that. I appreciate it. Thank you.
My sister, by the way. We'll keep doing it. It's the only way forward. Yes, of course. We'll keep on doing. Health insurance is the only way forward in so many aspects of our healthcare system. Yeah. Whether with or without the COVID crisis, we have to imbibe health insurance. We cannot fund our healthcare system without having an effective healthcare insurance. I am a strong believer in it because I am engaged in some aspect of health, and an aspect of health that is very expensive to fund. That is cancer care. Most of our patients, or almost all the patients, even the well-to-do high earners, cannot afford to treat cancer out of pocket to its logical conclusion. You cannot even diagnose it. So the only way we're going to be able to do it is to pull together resources. And the only way that we can get those resources is by having an effective healthcare insurance system. And for some reason, we have not addressed that properly in Nigeria up until now. We are only starting to do it now, but we're doing it in a very, shall I say, systematic way. And so this crisis, they have started doing some work. I don't have the details of it yet, but I know that the healthcare workers were addressed, and also there's also funding going into it from the NHIS and the states also that have signed up are going to start their own funding from it. If we focus more on that, the haphazard way ecological funds, we don't know wherever the funding from, he had to find it. But it can't continue like that. There has to be a more formal way of funding this kind of epidemics. And the only way that is going to be done is by taxing what people are earning. The NHS in countries like the United Kingdom, they cope to a certain extent, but even they broke down because they have functional and effective healthcare insurance systems that operate based on when you work, they take out a portion of your salary and put it aside for the rainy day when you need to go to hospital. It's as simple as that. Either the formal or the informal sector, they have to be taxed. It's a tax on your earnings. That's all it is. So yes, I'm a firm believer in health insurance, and we have to keep looking towards that way. Thank you.
Yeah, thank you so much. Unfortunately, we can't take all the questions. I just felt that, you know, both of you should give your parting words. And I think you should frame it around the objectives of this hashtag Prevent Epidemics Niger project. Because one, we want to advocate for increased funding for epidemic preparedness. And second, we want to increase awareness, you know, of Nigerians as far as epidemics are concerned, so that we can have an active citizenship for health for epidemic preparedness. So just in summary, what is one thing you think our participants should take away today as far as funding epidemics is concerned in Nigeria? We'll start with Zuwaira, then end with Dr. Zainab.
Okay. So for me, I think the one of the things that we've really been focusing on around epidemic preparedness is actually immunization. Right? We know that immunization is key. If people are immunized, then we have immunity, and some of these issues will be better able to tackle. And so we can't stop. We can't reduce vaccinating kids. We can't stop talking about polio. We can't stop talking about routine immunization. We can't stop talking about malaria. So I think the important thing is to just know that this crisis, it's a really sad, it's a sad thing, but it's an opportunity for us to really recognize how important it is for us to stay engaged in the original fights that we've been doing over the past many years to improve the well-being of Nigerians. Because even if we have insurance, if there's no proper hospital for people to go to, then what do you do with the insurance? Even if we have insurance, if we don't have enough vaccines or enough access or enough primary healthcare centers that work, then how would we manage the insurance? So yes, we need more funds. We need more private funds. We need more public funds. We need a bigger percentage of the budget to go towards health. I mean, everybody knows the Abuja agreement was 15%, right? We haven't quite hit it yet, but I think it's really important that we keep advocating that happens. And what we have, you know, first ladies like Dr. Zainab who understand what's at stake. I think this is why a voice of somebody like hers is so important in the debate, because she has, you know, access in a way that a lot of people don't. So, you know, being able to advocate for, look, we need to do this. We need to not forget immunizations. We need to think about how do we manage malaria. Hospitals need to stay open because women are still giving birth. People are still having cancer, high blood pressure, diabetes. And so we have to just recognize that health has always been important, but now COVID is just making us open our eyes wider about what needs to be done.
Okay, thank you, Zuwaira. So Dr. Zainab, over to you. Same question. What do you want people to take away from this webinar as far as funding for epidemic preparedness is concerned?
Well, I think that we need to keep on talking about it. It's very important that we keep speaking to the issue. We have been somewhat prepared, but not as prepared as a country the size of Nigeria obviously needs to be. People in the health sector need to speak to the issue of funding epidemics more and without any inhibitions whatsoever. Interregional cooperation must be spoken about and must be established for disease surveillance and epidemics to be properly controlled. The issue of health insurance, like I said, is one that is very dear to me. And Zuwaira, I hope that while you are allocating the funding that you are putting together under COVID, you will also look towards putting a good portion of it towards the health insurance. Private sector is very welcome when it comes to putting putting together insurance, and this will go away. All the funds that you're buying 5 kg rice with that is being controversial will go away, but the insurance one will stay for a long time, and there will be a lot of benefits to all the organizations that are in it. And it would take a longer time for the effects to be seen, but that is more long lasting and that is more structured. And I think that is the way to go. And again, it's devoid of the usual government and public talks and things like that. So I think that's a very good way to look at it. And of course, supporting the apex body that is involved in all this, that is to say the NCDC.
Okay.